Hello, and thanks for joining me once again on another episode of the program Easy Access to Healthcare for All, bringing you news and issues around the National Health Insurance Authority and the health insurance ecosystem at large. The attainment of universal health coverage is a major mandate of the NHIA. However, without the proper deployment of information and communication technology, it can never be achieved. The management of the National Health Insurance Authority understands this as a fact and has taken steps to ensure efficient deployment of ICT facilities to support its activities. In this episode, we speak with Acting General Manager, Department of ICT in the agency, and he enlightens us on the eNHIA project, a medium for automation of the NHIA processes and its impact so far. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In our lineup, Director General of the NHIA bags NHIA Award. Details of these and other stories coming up in our news update.
The Director General of NHIA, Professor Nasir Mohammed Sambo, has received an award for compliance to NHIA's IT clearance regulations at the Government Digital Service Promotion Award 2022, organized by the National Information Technology Development Agency, NHIA. The event, held at the International Conference Center, Abuja, during the 2022 edition of the Nigeria Digital Conference and Exhibition that held between 25th to 27th October.
Congratulations.
Professor Sambo was represented at the ceremony by the Acting GM of the ICT Department, Mr. Joseph Amakro Bonwo. The management of the National Health Insurance Authority organized a 3-day procurement training for its staff. Participants were drawn from departments, statutory units, and zonal offices. Others include procurement staff in the headquarters and state offices. At the event, the Director General, who was represented, said the training was part of the reforms going on within the NHIA and an effort to acquaint participants with civil service procurement rule.
In service, if you are ignorant of the law, that is not an excuse at all. For instance, as a staff, if you run foul, if your activities run foul of public service rule, you'll be punished. There will be no excuse to say, I don't know. Similarly, when you are procuring goods, when you are procuring works, goods and services, there are rules guiding them, and they are captured under procurement laws. So if we are procurement officers and we are chief executives of our state offices, it is imperative that you acquaint yourselves with the nitty-gritties of the procurement laws.
Speaking at the event, the General Manager Human Resources urged participants to pay attention as the training will help them in discharging their duties.
And bear in mind that the content of the public procurement comes with one thing that is very important: offenses and penalties. And that is a very key issue that needed to be understood well, so that people will now be properly guided, so that they will not have to challenge in terms of saying that they don't know, because ignorance of the law is never an excuse.
Some presentations at the training included understanding the public procurement process and the Public Procurement Act 2017, procurement planning and record-keeping procedures, technical and financial evaluation of services, etc. Participants shared their thoughts on the training.
I've been being equipped on how to manage procurement processes, and because of this training, I've learned that you must allow or put everybody, all contractors that have come for a bidding process on the same pedestrian. Allow the spirit of fair play, justice, and equity to guide you in the course of everything you need to do in the course of the procurement process.
Many of us were just part of this, were in the system. We didn't really know much about how the system was being operated. But now that they say they want to hand over powers to the states, and they brought us here, come and let us know more about the integrity, how procurement matters have been done. I tell you, we have gained a lot.
One hospital told him to bring one.
The National Health Insurance Authority, NHIA, recently carried out a sensitization exercise for staff of the Federal Mortgage Bank of Nigeria. Staff were educated on their rights as enrollees of the National Health Insurance Scheme, some of which they were unaware of.
When a service is covered, you don't pay for the service at all. What you pay is 10% of the cost of drugs. That's what you pay. The total cost of drugs, you pay 10% of it. Not for the service. For instance, CS, you won't pay for CS, but you pay for drugs dispensed to you in the course of the treatment.
The team from NHIA was led by the Deputy General Manager, Press, Mr. Emmanuel Ononopono. He further said the lack of awareness of enrollees about their rights make them unable to access the services the scheme provides for their benefits.
Don't pay more than 10% for the cost of drugs. Please call us whenever you are in doubt. Please call us.
Mr. Emmanuel enjoined staff of the FMBN to make maximum use of the services the scheme offers, as it is in their rights to do so.
The impact of information and communication technology in every human endeavor can never be overemphasized. The National Health Insurance Agency is benefiting immensely from automation as its operations are digitalized, which results in speed, reliability, and accuracy in its operations. Little wonder then that the DG of the NHIA received an award for compliance to NITDA's IT clearance regulations. The NHIA is not resting on its oars as it is pursuing the eNHIA project. Let's get an update on the eNHIA project. Please don't go away.
One sector that relies so much on information is the healthcare delivery system, as it involves a lot of data and information on its subscribers. The National Health Insurance Authority was created by the federal government to give Nigerians affordable and accessible healthcare. However, with the evolution of the health insurance, the only way data gotten from enrollees can be maintained and sustained is through the use of ICT. No wonder then that the NHIA is practically ICT driven. To bring all of its processes together, the NHIA embarked on a project that will help it deliver on its mandate called the eNHIA. Mr. Joseph Amakrogongo is the Deputy General Manager of ICT at the agency. He gives an update on the eNHIA project and how it is making the NHIA processes seamless.
NHIA's automation processes actually is divided into 4 phases, and it had to do with started with transition from the previous platform to this platform that we're developing. Then it's now went into building infrastructure. The entire infrastructure has to be rebuilt. That's the hardware infrastructure, connectivity, and then the software component of it also. So we have done that, and then we now go into data gathering, health information data gathering across all the stakeholders, and then integration. Data gathering and integration is where we are right now, and we're about moving into self-service. Thereafter, we'll have everything put all together, and then enrollees can access their data, they can update their data. For now, they still have to visit our state offices to do their enrollment, update their data. But since we have gathered, we have integrated the data across the board, can be accessed from 38 locations across the country that we have offices. Now we are developing upscaling to the last phase, which will be the self-service.
There are various processes involved in automation, like enrollment and registration, etc. Mr. Joseph highlights the impact of the automation in those areas.
Before now, enrollment was centralized, manual, paper-based. We had a situation whereby across the state, all the states of the federations, enrollee will go, fill forms, and attach passports, fill forms, and these forms are shipped or transported to headquarters, Abuja. You can imagine the kind of data loss, mutilations here and there. These forms are also scanned. They are scanned into a database that had no uniqueness. So we had a lot of duplicates, and the integrity of our data could not be vouched for. So we're losing a lot. Enrollees will enroll and their data will not be good. They cannot access care. So enrollees were also suffering from that manual or semi-manual process of automation, of registration. However, with the advent of eNHIA into the enrollment has become digitized. We now enroll digitally, and you can enroll from any state of the federation, our state offices. You enroll digitally, your data are captured. You are also NIM verified, because we've integrated our database fully with NIMC. You are also NIM verified to ensure that there are no duplicates and to ensure that our database has integrity.
Explains further on other features of the eNHIA project.
But right now, we're enrolling across the states digitally, as I stated earlier on. Right now, we are adding programs also from the programs department. So we are enjoying the benefits of the automation already. And we're improving on those automation, because any system that you develop in ICT will rely on feedback of users. You now use the feedback from the users to improve service delivery. That is what we are doing right now.
The impact of this automation is not only felt by the authority alone, but also enrollees who will have little or no challenges when they visit healthcare facilities.
Before now, the inability of people to, when they get to the hospital and their records are not there, you can see that it also engenders danger into the life of Nigerians. But now we have a process whereby your data are captured and are quickly made available at facilities at their apportioned time, and you can go there and access care. That means we have a Nigerian populace that is healthy and very productive, and it will also help the economy of the nation.
A critical question in the mind of enrollees is whether or not the eNHIA will address problems around service authorization or referral, which is a major challenge encountered within the health insurance processes.
Before now, we've had a lot of complaints concerning that. But what the eNHIA is bringing on board is a national call management center that will serve as grievances redressal channel. If, for example, you go to the hospital and you are referred and code requests have been sent from the hospital to the HMO, we will be able to track that request through the dashboard of our call center. And then this dashboard will also be available on handies, on maybe through the browser. And so programs department within NHIS that are responsible to monitor it will monitor the timeline for each of the requests. After a certain threshold, there will be a yellow flag or red flag if it has not been attended to by the HMO. And at any point in time, when it turns to a red flag, the authority will take over and issue that referral code so that the enrollees will not be made to wait like 10 hours and so as they're doing right now. So the impact of what this technology is bringing is that there won't be delays any longer. Monitoring and evaluation of the performances of the stakeholders in the health insurance ecosystem will be done by the authority.
He speaks further on other innovations adopted by the NHIA.
New technology revolves around building infrastructure to safeguard your data, building infrastructure to process your data, building infrastructure to clean and then have pure data. We have built the monitoring and control center here in Abuja. From there, you can see and monitor all our sites across the country, what they are doing as per enrollment. You can monitor the status of our connectivity active equipment that has been deployed across the country to ensure that we are well interconnected. And again, we have our primary servers co-located with GBB because they provide that facility. Then so that we can have an uninterrupted service 24/7. They have that facility we have co-located, and also we have recovery centers whereby we have our servers, we have our data being replicated into. That should there be a fail, there is also a redundant server that will take over so that we don't experience any timeout or any downtime in the health insurance progress.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. In this episode, we are looking at Barrow Dikko Teaching Hospital, which is located in the heart of Kaduna Metropolis. The healthcare facilities caters for over 6,000 NHIA enrollees, offering primary, secondary, and tertiary medical services. We chatted with Dr. Ramatu Abubakar, HOD, Family Medicine and Coordinator of NHIA units at the Barrow Dikko Teaching Hospital, Kaduna. As a stakeholder, she speaks on some of the benefit of being an enrollee of the NHIA.
In terms of waiting time, we have different stations for NHIs and also regular patients. We are not trying to discriminate. We usually separate to ease our work. The NHIS unit has its own record, different from the regular patients. And then we have our own doctor and the clinic running different from the regular patients, and also different pharmacy. Everything different. That is number one. And number two, when NHIS patient comes, the NHIS patient doesn't pay for registration like regular patient. Regular patient pays 500 when the patient is new patient, and also pays 200 when it's a follow-up patient. But NHIS patient doesn't pay such fee.
Dr. Ramatu also shares with us some challenges hospitals face with some NHIA enrollees.
What we observe and then what we have been facing with NHIs enrollees are, number one, they tend to claim rights. They are always on the right that they always want to tell you that it's their money they are contributing, that they contribute money, so it's their rights to get access to health. Not knowing that this is based on the principle of solidarity. The wealth subsidize for the poor. The healthy subsidize for the sick. So they are not aware that there's the principle. Maybe they need to be enlightened about this. So apart from that, most of them are public workers, so they are civil servants, so they come at any time they want. And another challenge is that some of them tend to abuse the system. For example, they will give their ID card, or they will just invite someone outside the beneficiary to come and assess. They give their ID card. So if care is not taken, if the logistic is not been done, if the protocol is not duly followed, we end up losing.
In closing, Dr. Ramatu has this advice for those who are yet to register as enrollees of the NHIA.
I will advise these people to find among the programs of NHIS to get a role into, even if it is not the formal program, which is usually the formal sector that we are operating. There are other programs of NHIS. They should try and get a role to protect them from huge bills, huge medical bills. That is the catastrophe of these bills. There are other options like community-based social health insurance they can get involved in, which is usually all about the cohesive group of people. It can be occupational base or household base or family base, anyone of that nature.
That was Dr. Ramatu Abubakar, HOD Family Medicine and Coordinator of NHIA Unit at the Barrow Dikko Teaching Hospital, Kaduna. We'll now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
That's our package for the week. And if you were with us from the beginning, you will see that our focus was on the eNHIA and how it will advance the course of health insurance towards universal health coverage. And if you missed this episode or others, you can watch the program on our YouTube channel and other social media platforms showing on your screen. See you next week, and God bless Nigeria.